Eating large amounts of red meat while getting too little fiber can quietly affect urinary health in ways many men over 60 never realize. The connection between diet and bladder function often goes unrecognized, but it's a significant one. Urologists frequently point out that diets high in red meat, especially processed or fatty cuts, can lead to chronic inflammation throughout the body, including in the prostate. An inflamed prostate can swell and press against the urethra or bladder, making urination more difficult, more urgent, or more frequent. This pressure can lead to interrupted sleep, discomfort, and even anxiety around using the bathroom in public settings. Prostate inflammation, also called prostatitis, is more likely to flare up with a diet lacking in anti-inflammatory components like fiber-rich fruits, vegetables, and whole grains. Some studies have suggested that red meat, especially when cooked at high temperatures, may also release compounds that contribute to inflammation in the urinary tract. Over time, this can make the bladder more sensitive and reactive, resulting in stronger urges to go and reduced control over holding urine. Constipation is another issue tied directly to diet. Without enough fiber, the digestive system slows down, and stool can become hard and difficult to pass. When stool builds up in the rectum, it can physically press against the bladder or the nerves that control urination. This pressure may cause incomplete emptying of the bladder or a constant feeling of urgency. Doctors often see this scenario in older men who haven't changed their diets to match the slower pace of their digestive systems. It becomes a double burden, struggling with bowel movements while also dealing with disrupted bladder function. Increasing dietary fiber can ease both problems. Fiber softens the stool and promotes regular bowel movements, reducing the pressure around the bladder and lowering the chance of urinary issues. It also helps lower cholesterol, manage blood sugar, and support a healthier weight, all factors that contribute to overall bladder and prostate health. While adding more fiber doesn't reverse all damage, it sets the stage for gentler, more balanced function of both the digestive and urinary systems. Some urologists recommend shifting protein sources away from red meat and toward leaner options, like fish or plant-based proteins. These alternatives reduce the body's inflammatory response and support better long-term outcomes. What men eat every day may not seem directly linked to how often they use the restroom or how strong their flow is, but over time the connection becomes hard to ignore.
A diet that's heavy on red meat and low on fiber quietly taxes the prostate and bladder, creating issues that many men mistakenly chalk up to just aging. By choosing meals with more vegetables, legumes, and whole grains, and easing back
on heavy meats, men over 60 can support not just their digestive comfort, but also their urinary control. Food is not just fuel. It's a daily influence on inflammation, pressure, and performance in systems that are too often overlooked. Making that connection can change the entire picture of health after 60. Subtle changes in bedroom performance are often brushed off by men over 60 as just another part of aging. But dismissing these changes without understanding their cause can allow more serious health problems to go unnoticed. According to many urologists, issues like reduced stamina, delayed arousal, or softer erections can be early signs of underlying medical conditions, not just age catching up. These changes are frequently linked to reduced blood flow, which may indicate the beginning stages of cardiovascular disease. The same blood vessels that supply the heart also support function in more intimate areas, and problems there can often show up earlier. Low testosterone is another common reason for changes in desirable performance. Testosterone naturally declines with age, but when the drop becomes too steep, it can affect energy, mood, and sexual health. Hormonal imbalance is treatable, but only if it's acknowledged and tested. Urologists often suggest that ignoring these signals delays not only solutions for intimacy, but also broader treatments that could benefit overall wellness. Prostate health also plays a major role. Conditions like benign prostatic hyperplasia or even early-stage prostate cancer can subtly interfere with sexual function. These aren't issues that resolve on their own. Left unspoken, they may progress quietly. That's why some doctors urge men not to stay silent out of embarrassment or resignation. Addressing bedroom difficulties isn't just about intimacy. It's about identifying deeper concerns that may be affecting the entire body. When men speak up early, they open the door to treatments that can restore both health and confidence. Ignoring the signs only allows problems to grow in the shadows. Holding in urine for long periods may seem harmless, especially when restrooms aren't easily available or when embarrassment makes someone hesitant to excuse themselves. But for men over 60, this habit can have serious long-term consequences that often go unnoticed until the damage is already done. The bladder is a muscular organ meant to expand and contract efficiently. When urine is held in too long or too often, it places excessive strain on those muscles, causing them to stretch beyond their normal capacity. Over time, this repeated stretching can weaken the bladder wall, making it less responsive and less capable of emptying fully. Some urologists caution that incomplete emptying of the bladder increases the risk of residual urine staying behind, a condition that can promote bacterial growth and lead to urinary tract infections. In older men, especially those with an enlarged prostate, this residual urine problem becomes more common and dangerous. An enlarged prostate can already restrict urine flow. Combining that with habitual urine retention only adds pressure to an already strained system. Infection risks rise, and if untreated, they can lead to complications such as bladder or even kidney infections. In more advanced cases, men who consistently delay urination may develop a condition known as urinary retention, where the body struggles or fails to release urine even when the bladder is full. This can result in painful emergency situations and may require catheterization. Doctors have reported that long-term urine retention can lead to bladder stones and, in rare but severe cases, kidney damage due to backflow of urine. This is especially concerning for aging kidneys, which are already more vulnerable to decline. Another issue tied to holding urine too long is the disruption of the bladder's natural signaling system. When someone habitually delays going to the bathroom, the brain and bladder can start to miscommunicate, dulling the urgency signal. This may cause delayed or reduced awareness of the need to urinate, increasing the chance of leaks or accidents. Exactly what many older men are trying to avoid in the first place. Pride, stigma, or simple inconvenience may lead many to hold off on using the restroom, especially in public places. But doctors urge men over 60 to prioritize timely urination. The consequences of delaying can quietly build up over time, leading to discomfort, embarrassment, and health complications that are far harder to treat than they are to prevent. Making the effort to relieve the bladder when the urge first arises is not only a matter of comfort, it's a key act of self-care for long-term urological health. Some men over 60 start cutting back on water during the day because they're afraid of urgent bathroom trips or accidental leaks. While this might seem like a simple way to avoid embarrassment, it often causes more harm than good. Urologists frequently warn that reducing water intake to prevent accidents can backfire in serious ways. The body still needs hydration to function, especially as it ages. When water is restricted, the urine becomes more concentrated, irritating the lining of the bladder and increasing the urge to go, the very problem men were trying to avoid in the first place. Concentrated urine doesn't just irritate the bladder. It also creates the perfect environment for bacteria to grow, increasing the risk of urinary tract infections. Though UTIs are more common in women, men over 60 are not immune. In fact, as prostate size increases with age and bladder function weakens, the risk rises. Some studies have shown that chronic dehydration may lead to more frequent or more severe urinary tract infections in older adults. These infections can be painful, hard to diagnose in time, and may even lead to more serious complications if they spread to the kidneys. Another consequence of low water intake is kidney strain. The kidneys filter waste from the blood and rely heavily on proper hydration to do their job. Without enough fluid, toxins can build up, and kidney function may decline over time. In extreme cases, chronic dehydration can contribute to kidney stones or long-term kidney damage. Urologists often see this in patients who believed they were helping their bladder by drinking less, when in fact they were putting both their bladder and kidneys at greater risk. Avoiding fluids may offer temporary relief from urgency, but the long-term cost can be high. Some doctors recommend spreading water intake throughout the day rather than stopping it entirely, and adjusting timing, such as reducing intake right before bed, instead of cutting back altogether. Hydration is not optional for men over 60. It's essential to bladder health, kidney function, and overall well-being. Skipping water might seem like a harmless choice, but it quietly invites a cascade of problems that are much harder to manage later. Waking up once during the night to use the bathroom is generally considered normal for men over 60, but when those trips become 2, 3, or even more each night, it should not be brushed off as just a part of getting older. Ignoring frequent nighttime urination, known medically as nocturia, can quietly point to deeper health concerns that often go unchecked until they become disruptive or dangerous. Some doctors warn that repeated nighttime urination may indicate an enlarged prostate, a condition called benign prostatic hyperplasia, or BPH. This is common in older men, but its symptoms can worsen if left unaddressed, affecting both bladder control and sleep quality. Bladder dysfunction is another underlying issue that may cause excessive nighttime trips. The bladder might not be emptying fully or could be overactive, signaling a loss of coordination between the bladder muscles and the brain. In either case, the result is the same: repeated sleep interruptions that chip away at energy, mood, and overall health. Poor sleep itself becomes another health risk, affecting memory, heart function, and immune strength, all things that matter even more after 60. In some cases, nocturia can even hint at more serious problems like diabetes or kidney issues. That's why it's so important not to normalize it without question. While some men may feel embarrassed or think it's just something to live with, the truth is that addressing it early can lead to better outcomes. Urologists often recommend a full evaluation if nighttime urination becomes frequent. This might include a physical exam, urine tests, or even a sleep assessment, depending on the situation. The key is not to wait. Men over 60 should never assume that getting up several times a night is simply part of aging. It may be common, but that doesn't mean it's harmless. Paying attention and speaking up early can make a real difference. Pelvic floor exercises are often overlooked by men, especially those over 60, who may believe they are only for women. But this misunderstanding prevents many men from benefiting from one of the most effective and non-invasive tools for improving bladder control, supporting prostate recovery, and even enhancing confidence in daily life. The pelvic floor is a group of muscles that stretch across the base of the pelvis and play a critical role in controlling urination, stabilizing the lower abdomen, and supporting sexual function. When these muscles are weak or inactive, problems like leakage, urgency, and even erectile difficulties can become more frequent. Some urologists emphasize that men, particularly those recovering from prostate procedures or dealing with enlarged prostates, can greatly benefit from strengthening their pelvic floor. These exercises, often referred to as Kegels, work by helping men better control the muscles that stop urine midstream. With consistent practice, this control can translate into fewer accidents, less urgency, and a greater sense of bodily confidence. Doctors often recommend pelvic floor exercises before and after prostate surgery because they help patients regain bladder control more quickly and reduce the risk of long-term incontinence. Research has shown that pelvic floor training can be just as effective for men as for women when it comes to managing urinary symptoms. One study published in the Journal of Urology found that men who practice pelvic floor exercises daily experienced significantly fewer bladder leaks and improved overall urinary control. Despite this, many men are never taught how to locate or use these muscles correctly. The lack of public awareness and the misconception that these exercises are not masculine continues to be a barrier to better health outcomes. Avoiding pelvic floor exercises doesn't just mean missing out on an opportunity to improve bladder control. It also increases reliance on medications, pads, or behavioral avoidance, like staying close to bathrooms or reducing fluid intake unnecessarily. These workarounds can limit a man's freedom and self-esteem. In contrast, engaging the pelvic muscles through short daily exercises offers a discreet and empowering way to take control of one's body again. Practicing pelvic floor exercises doesn't require a gym, special equipment, or even visible movement. They can be done while sitting, lying down, or standing, making them accessible to nearly everyone, regardless of physical condition. Some healthcare providers suggest beginning with short sets of muscle contractions, holding each for a few seconds and gradually increasing over time. When done correctly and consistently, results often begin to show within a few weeks. For men over 60, understanding that pelvic floor health matters is the first step. Accepting that these exercises are not only for women, but vital for male, urinary health is the next. Using pelvic floor exercises regularly can restore a sense of control, ease anxiety around bladder leaks, and support recovery from common prostate issues. There is nothing weak or embarrassing about strengthening a part of the body that plays such a key role in dignity, comfort, and everyday life. Instead of avoiding these exercises, embracing them can be one of the smartest, most powerful habits a man can form in his later years. Delaying a visit to a urologist until symptoms become unbearable is one of the most common and costly mistakes men over 60 can make. Urologists aren't just for emergencies or late-stage conditions. They're crucial partners in prevention, early diagnosis, and long-term management of issues that affect quality of life as the body changes with age. Many men avoid seeing a specialist due to fear, shame, or the belief that urinary or sexual problems are just a normal part of getting older. But when subtle symptoms are ignored for too long, conditions that might have been easy to manage early on can progress into more serious, sometimes irreversible problems. Prostate health is one of the most important reasons to build a relationship with a urologist after 60. Conditions like benign prostatic hyperplasia, BPH, prostatitis, or even early prostate cancer often develop silently. Some men notice changes in urinary flow, increased urgency, or frequent nighttime trips to the bathroom, but delay seeking help. According to the American Cancer Society, prostate cancer is one of the most common cancers in men, and early detection often makes the difference between simple treatment and a more complicated battle. Urologists can monitor the prostate with exams and tests like PSA levels, catching changes early before they become dangerous. Urinary symptoms are another area where early consultation matters. Hesitation, dribbling, weak flow, or a sense of incomplete emptying may seem minor, but they often signal deeper problems with the bladder or prostate. Left unaddressed, these issues can lead to infections, retention, or even kidney damage. Some doctors explain that the bladder can lose strength over time when forced to work against blockages caused by an enlarged prostate. Once that muscle weakens, recovery becomes more difficult, which is why early guidance from a specialist can prevent complications that are much harder to reverse later. Hormone health is another reason not to wait. Low testosterone is common in men over 60 and can affect everything from energy and mood to sleep and sexual function. But without speaking to a urologist, many men live with these symptoms, assuming they're simply part of aging. A specialist can check hormone levels, identify imbalances, and offer treatments that restore vitality and confidence. This can often improve not just physical health, but emotional well-being and relationships as well. Embarrassment is one of the biggest barriers to early consultation, especially when symptoms involve intimacy or bodily functions. But urologists handle these issues every day with professionalism and compassion. Waiting until a crisis forces a hospital visit limits the options and often leads to more invasive procedures. In contrast, addressing small changes early gives men access to simpler solutions, whether that means medication, exercises, lifestyle adjustments, or routine monitoring. Some urologists also help with preventative strategies, offering guidance on pelvic floor exercises, fluid management, and early lifestyle changes to support bladder and prostate function. This kind of proactive care is often overlooked but can make a meaningful difference in long-term independence and comfort. Not talking to a urologist until things get serious is a decision many men later regret. Reaching out early may feel uncomfortable at first, but it offers reassurance, support, and control in an area of health that too many people leave to chance. There is strength in facing these changes directly, and a good urologist can help make that path clearer, easier, and more effective.